Good afternoon, everyone, and welcome to the Second Chance Act orientation webinar for the Reentry Program for Adults with Co-Occurring Substance Use and Mental Disorders. First off, I just want to give you a big congratulations on these awards. Lots of people apply for these awards. They're very competitive, and the fact that you're selected really says a lot about your jurisdiction's efforts to want to really affect change regarding substance use and mental health within your criminal justice system. So on the webinar today, there we go. So we have several speakers on the webinar today. The first speaker that I'll introduce is Andre Bethia. He's a policy advisor for corrections at the Bureau of Justice Assistance in the U.S. Department of Justice. He previously served as the Director of Program Operations and Policy at the New York City Department of Corrections, where he managed external relationships with community-based organizations and research institutions, as well as developed policy and curriculum, identified best practices, supervised programmatic initiatives for adolescents and young adults in custody. Bethia's career in criminal justice began as an analyst for the New York City Department of Police. We also have Lieutenant Dennis Pass, who's the Reentry Coordinator at the Rockdale County Sheriff's Office in Georgia. Lieutenant Pass has been a program manager for reentry at the Rockdale County Sheriff's Office for the past 23 years. He manages reentry services at Rockdale Jail, which is community-wide support and includes the Rockdale Reentry Prevention and program funded by the Second Chance Act. So his jurisdiction was actually awarded a Second Chance Act for co-occurring disorders, which we call this grant program for short, in fiscal year 2013. And they also were a pilot site for the RNR Simulation Tool, which is a requirement under this grant. So we'll hear from Lieutenant Pass later for him to talk a little bit about his experience as a grantee. So now to introduce the team at the Council of State Governments Justice Center. We have Mark Stovall, who's a policy analyst for behavioral health. He works with Second Chance Act grantees to design and implement programs for people with co-occurring substance use and mental disorders, and supports projects at the intersection of behavioral health and criminal justice. Before joining the CSG Justice Center, Stovall worked for the National Center on Addiction and Substance Abuse in New York City, where he contributed to research and policy reports. He also may be known to you as your technical assistance provider. So some of you have already heard from Mark and have begun to set up orientation calls with him. So happy to have Mark here. So Allison Upton is a senior policy analyst for behavioral health at the Council of State Governments Justice Center, and like Mark, she is one of the TA providers for this cohort. Allison, unfortunately, is on travel today, so she's unable to speak on this webinar, but wanted to make sure to introduce you for all of those who will be receiving TA from Allison. Allison provides technical assistance to grantees and supports policy development and projects specializing at the intersection of criminal justice and behavioral health. She previously was the Director of Courts Programs at the Center for Alternative Sentencing and Employment Services, where she oversaw the court and community operations of alternatives to incarceration and detention. There, she developed gender-specific track of the ATI services for women, and trained on evidence-based practices, screening and assessment in justice setting, trauma-informed case management practices, and cognitive behavioral group interventions. So many of you have also heard from Allison to set up your technical assistance calls, and I know that she sends her greetings and is very excited to work with you all over the course of your grant period. And lastly, I am Sarah Wurzberg. I'm a Deputy Program Director for Behavioral Health at the Council of State Governments Justice Center, and I oversee the training and technical assistance for the Second Chance Act Reentry Program for adults with co-occurring substance use and mental disorders, as well as the Justice and Mental Health Collaboration Program. I also oversee our work on courts and on substance use disorders. On today's webinar, we're going to give some introductions to the Department of Justice, to the Council of State Governments Justice Center. We're also going to provide an overview of the Second Chance Act Co-occurring Disorders Grant Program, talk a little bit about what training and technical assistance is, and how the planning and implementation guide is used within our technical assistance, which is a really key part of how we support grantees. We're also going to introduce to you the RNR Simulation Tool, which is part of the grant requirements for this year. As a note, we'll also have follow-up webinars that go in more depth about the RNR Simulation Tool. Then we're going to hear from Lieutenant Pass, who I introduced earlier, and he'll talk about his grantee experience of being a co-occurring grantee and also implementing the RNR Simulation Tool. And we'll have plenty of time for questions and answers. If you have a question while someone is speaking, there's a chat box in the right corner of your screen, and you can feel free to write questions in, and we'll answer them at the end of the webinar. Now I'm going to turn it over to Andre Bethia to talk a little bit about the Bureau of Justice Assistance.
Thanks, Sarah. Good afternoon. My name is Andre Bethia, and I am the policy advisor who oversees the Second Chance Act Reentry Program for adults with co-occurring substance use and mental disorders in the policy office at the Bureau of Justice Assistance, or better known as BJA. First off, I want to congratulate you on securing grant funding in an incredibly competitive year. Your applications were screened for basic minimum requirements and were reviewed, rated, and scored by panels of external peer reviewers, and after an internal review by BJA staff, you were recommended to the Assistant Attorney General for funding. So, congratulations on your award. At BJA, our mission is to provide leadership and services in grant administration and criminal justice policy development to support local, state, and tribal justice strategies to achieve safer communities. The Second Chance Act has supported over $300 million in reentry services since it was passed in 2008. Now I will turn things back to Sarah, who will provide some information on the Council of State Governments Justice Center and the National Reentry Resource Center.
Thanks so much, Andre, for that great introduction on the Bureau of Justice Assistance, the funding agency for your effort here. So I'm going to introduce the Council of State Governments. We are a bipartisan policy solutions organizations dedicated to all three branches of governments. And then in the Justice Center, we work on specifically criminal justice issues. This is an example of some of the work we've done in the past. So on the upper right-hand corner, you'll note there is a document about behavioral health needs under correctional supervision. And this really is a key piece of what we do in our technical assistance, is thinking through strategies and ways that policy can develop and can improve for people with behavioral health needs. And we actually built on this work to develop a collaborative comprehensive case planning tool that's a web-based tool that we'll talk about later in this webinar. We also work in a bunch of other areas such as reentry and employment, justice reinvestment, and even school discipline. At the Council of State Governments Justice Center, we were lucky enough to be awarded the contract to run the National Reentry Resource Center. So when the Second Chance Act was passed in April 2008, part of this also included a Training and Technical Assistance Center, also known as the National Reentry Resource Center. Since its inception, the Council of State Governments Justice Center has been fortunate enough to be the technical assistance provider. And the NRRC, through this work, has provided training and technical assistance to over 600 juvenile and adult reentry programs since the beginning of this. So this is the National Reentry Resource Center's website, and you can see you can actually subscribe to a newsletter as well. And we really recommend this because we send out lots of great resources on reentry and behavioral health, but not just that, other topics such as reentry and employment, reentry and education. So it's really meant to be a one-stop shop for reentry, and your TA providers will follow up with additional information on this as well. So now I'm going to pass it over to Andre, who will give an overview of the Co-Occurring Disorders Grant Program.
Thanks, Sarah. To begin with, I will provide a bit of information on the history of the SCA Co-Occurring Disorders Grant Program, or SCA COD for short. $55 million has been awarded to grantees over the past 6 years to state, county/local, and tribal jurisdictions across the United States. Well over half the states have been awarded grants through this program. There have been 97 total awards through the Second Chance Act Co-Occurring Disorders Grant Program, as you can see from this map. That includes local/county, state, juvenile, and tribal grantees. In 2017, there were 8 awards through the Second Chance Act Co-Occurring Disorders Program, 5 local awards, 2 state awards, and 1 tribal award. The group represents a large geographic diversity covering the country from a tribe in Alaska to the south, east coast, from big, small, and medium-sized jurisdictions. As part of the orientation process, new grantees should have received information on attending the BJA and Second Chance Act orientation webinar, which occurred on Tuesday, November 21st. A link to that webinar is available on the National Reentry Resource Center's website. Today's webinar is focused on your cohort of fiscal year 17 Second Chance Act co-occurring grantees. In December, new grantees will have their orientation or introductory calls scheduled with your TA provider from the Council of State Government's Justice Center. These calls will be scheduled with either Mark Stovall or Allison Upton. There are several points of contact for your grant program. The Bureau of Justice Assistance, or BJA, is your funder, and with BJA is the Programs Office. I work in the Policy Office and oversee the grant program. On the Second Chance Act General webinar, you heard from a few of the team members in the Programs Office who manage the individual awards that each of you have received. The program grant managers, or state policy advisors, can answer all of your questions pertaining to allowable cost, management of the award, and reporting. They can also help you with any grant adjustment notices that you may have to submit during your grant. The National Reentry Resource Center provides training and technical assistance, including monthly calls and site visits through your TA providers. We work closely together to ensure that all the Second Chance Act co-occurring disorder grantees remain on track with their awards. Booz Allen administers the Performance Measurement Tool, or PMT, which is the online tool where you submit quarterly performance reports for your program. The Second Chance Act Co-Occurring Disorders Grant Program goal is to reduce recidivism and improve people's health outcomes through providing pre- and post-release co-occurring substance use and mental disorder services. This includes the use of a validated criminogenic risk and behavioral health assessments. Using these assessment tools to develop collaborative, comprehensive reentry case plans that will include information on integrated treatment for co-occurring substance use and mental disorders. Each program will focus on providing pre- and post-release services to program participants. Since each program was reviewed and selected based on criteria that uniquely qualified them as most competitive, I want to lay out some very specific expectations that we have of you. We, that is BJA, the Bureau of Justice Assistance, expect that you will serve the number of people you propose within your application. We expect that you will actively take measures to seek appropriate services for the targeted population or services designed to meet the needs of the population you serve. We expect that you will use criminogenic risk and behavioral health assessment instruments to provide integrated treatment. BJA expects that you will incorporate evidence-based co-occurring disorder treatment and address criminogenic risk factors. And lastly, we do expect that you will seek help when help is needed and communicate regularly with your technical assistance providers and BJA staff, including myself. During the planning phase, which is typically between 8 to 12 months, you will have access to up to $100,000 of the total award to complete the planning and implementation, or for short, P&I guide, and make sure your program is ready to move toward implementation. The P&I guides, as Sarah will talk through in further detail, are meant to help you effectively, strategically plan for your grant program. The P&I guides will be submitted to BJA and reviewed in order for your program to move to the implementation phase and, of course, gain access to the remainder of your grant funds. The planning phase is something that has evolved over time as we identified that grantees need to make sure they have the foundations of their program in place prior to implementing the program. It is going to help you build capacity to implement your program effectively from the first day. It will help your team and partners identify strengths, areas that need improvement. You will receive targeted technical assistance from the National Reentry Resource Center through Allison and Mark. We look forward to the exchange of ideas that always come out of this process and providing opportunities for you to connect with your peers. The planning funds can be used for a variety of things to support your program, including staff time to work with partners and collect data related to the RNR Simulation Tool. This is a new requirement for the Second Chance Act Co-Occurring Disorders Grant Track. The tool was piloted with the fiscal year 14 cohort. Lieutenant Pass, one of the panelists on this webinar, will share his experience with you about this later in the webinar. For the RNR Simulation Tool, each jurisdiction will choose which of the 3 portals you will be using for the grant. There will be further detail on the RNR Simulation Tool later in this webinar, but I wanted to let you know that each of you will need to submit a budget adjustment notice to pay for the storage and use of the tool. George Mason University Center for Advancing Correctional Excellence, the tool developer, will be receiving $6,000 per grant year for the use of the tool. You will work with your grants manager, who is the state policy advisor, and the programs office at BJA to make sure this is complete. Other uses of funds for the planning phase follow the goals of the grant program: to set up processes for screening and assessment, pre- and post-release services, think through how to fill gaps within your system, establish a program design, including incorporating an integrated care model and healthcare services, as well as continuing development of a continuum of care model. Improving screening and assessment processes, engaging in strategic planning for sustainability, Formalizing program partnerships, including partnerships with research and evaluation entities. Developing and strengthening strategies for increasing access to health care benefits for people in the justice system. And ensuring your program has a data collection strategy so that data can be used not just for entries into the performance measurement tool and the RNR Simulation Tool. Program evaluation is important to us in order to know if programs are successful. We at BJA encourage you all to be very thoughtful about your research and evaluation partnerships and work to have a plan to get data that gives you information on process and outcomes and can help with your program's sustainability. We want to ensure that after the award period, these programs continue to provide services to those who need them in your community. Implementation funds will be used to support your program through targeting people with high criminogenic risk and needs to be in your program in order to get the best recidivism reduction results. Using integrated and evidence-based substance use and mental disorders treatment and addressing criminogenic risk through cognitive behavioral programming. Support a comprehensive range of recovery services, provide evidence-based community supervision services, demonstrate ability to utilize a collaborative, comprehensive case management model. This piece I want to highlight as we have launched a web-based, collaborative, comprehensive case plan tool that will be of great use to you in this planning process. I encourage you to use that tool and work with your TA provider on this important piece. Plan for data collection, performance measurements, and quality assurance. Now, I will turn it back over to Sarah to further discuss the Second Chance Act Co-Occurring Disorders Planning and Implementation Guide.
Great, thanks so much, Andre. So I'm going to talk a little bit about the technical assistance through the National Reentry Resource Center, or NRRC as we call it for short. So a big part, as Andre mentioned, is working with you through the Planning and Implementation Guide. And these guides themselves have actually evolved over the past several years in order to really try to refine the pieces that we've seen that grantees have struggled with in the past to make sure that in the planning phase, some of the issues that might come up in implementation are already worked out to prevent any slowdown of work with the people in your grant program. We work to identify different performance measures and track progress to support you in building the research and evaluation partnerships, which are a high priority at the Bureau of Justice Assistance. We really work to answer any questions you might have. So if you're looking for resources on a specific screening and assessment tool, if you'd like to explore other evidence-based practices you might be able to use, if you're interested in talking to other sites that have specifically done a specific practice. These are the types of things that you can ask your TA provider, and they will work to provide you resources. We also are working with you to share your successes in addition to help you get through your challenges. So thinking through how you communicate with your stakeholders in order to show your successes, how you can be highlighted in the field and the press, and how this can help you with sustaining your grant program. So this is what our technical assistance looks like for the co-occurring grantees. So you have the TA provider, and this is your #1 source for information. If there's something that Mark or Allison cannot answer, they will find out for you. We have a lot of resources through the colleagues at the Council of State Governments Justice Center, as well as consultants and partners in the field. So they are really going to be a key part of it. Through your monthly technical assistance calls, you'll be talking to them on a regular basis, and they are really invested in ensuring the success of all of your grant programs. We also do a lot with peer learning. So a big part of this, as we mentioned, is we work with over 600 grantees. So we've worked with a number of jurisdictions around the country, such as Lieutenant Pass, who you'll hear from later. And we really like to try to connect jurisdictions with one another, so that way you can learn from each other. Because we often hear that the best way to learn about something is from someone who has done it. So we really work to try to make those peer-to-peer connections. We also provide access to experts. So we have webinars that we'll do throughout the year that will be specifically relevant to this grant track, and we also have consultants that we're able to utilize as well. In addition, we have resources and tools. So in addition to the tools that the National Reentry Resource Center has, we also send out other information from tools from other national organizations and resources that might be helpful. And as Mark will mention, even in our P&I guide, there's a whole section on resources that really answers some of those questions. If you're not sure how to address some of this stuff, what are some good resources on that? So the TA provider's job is really to provide this targeted technical assistance. So you'll be having monthly calls with them throughout your entire grant period. They will work with you step by step to help you get through the planning and implementation guide, which will set you up for success in your grant program. They can provide resources on various topics, from risk needs responsivity to screening and assessment to evidence-based practices to research and evaluation to sustainability. We also will have webinars, and they'll provide you access to webinars from the NRRC and other agencies that might be topics that you're interested in. For example, you might have mentioned you're interested in family engagement, then Mark or Allison sees another organization is hosting a webinar on that. They will be sure to flag that for you so your team has the opportunity to learn. We're also able to do site visits to grantees, and these will be in-person meetings, either during the planning phase or the implementation phase, where we really get to either sit down with you and really work with your stakeholders on various topics. Sometimes it also includes training or access to experts as well. So the site visits are really tailored to whatever will be helpful to move along the work for people with co-occurring disorders in the justice system in your specific jurisdiction. Some examples of technical assistance. So I know that some people may have received technical assistance before and it looks different in different places. So what are some of the things that we do? Well, we assist with thinking through data collection and analyses. So this is a part, you're required to collect the performance measurement tool, and then jurisdictions often have questions about how to collect that, and then also how to collect measures beyond that for research and evaluation purposes. So that's something that we often provide support on. We help facilitate strategic planning sessions and talk about who should be on reentry task force or your advisory group for the grant. So who would be good to be in the room in order to support the wider efforts of reentry in your community. Additionally, we do training on things like recidivism reduction, on promotion of recovery, on improving outcomes, on risk needs responsivity, on addressing behavioral health needs. Really, as an organization, our expertise is translating research into practice So whether that be at a policy level or at a program level, how can you take some of this higher level research that you might hear about in the field and actually translate that into the programming that you're doing to serve people in your correctional facilities and as they reenter the community. We also support the development and implementation of sustainability plans. So this is a really big thing that you're going to hear, is that as part of your planning and implementation guide, you'll develop some goals for sustainability. And really throughout the life of your grant, we'll keep coming back to this. So you applied for this program because you saw a gap or a need in your community. So after this grant funding ends, how can we make sure that you're still able to serve the people who need it? So in the planning phase, you will work with your TA provider in order to complete the planning and implementation guide. The key part of working with the guide is that really you just need to be honest and try to be accurate about the information that you have. So these questions are not a test. They're meant for you to just give information on what you plan to do with your program. So it's really just hones in on some program design issues that we find will be helpful to address before you reach the implementation phase. It's perfectly fine to give brief answers to these questions, and the TA provider will guide you through this. If they think there's not enough information or that there might be questions that will come out later, then they'll work with you to try to go through these exercises. So you do have a lot of support through this. And really what we try to do with the P&I guide is that we would request that you would fill out an exercise before one of your monthly TA calls with your TA provider. You would send it to them prior so they have the opportunity to review it before the call, and then you can have a discussion about, you know, the content of it depending on the section and what that looks like. And then if there are any changes, the TA provider will support you in working through those changes. So now I'm going to turn it over to Mark Stovall. He's going to talk about how the P&I guide is used, and then he's going to actually go through each section of the planning and implementation guide to give you a better idea of the P&I guide.
Thanks so much, Sarah. So as Sarah mentioned, I'm going to talk a little bit more about how the planning and implementation guide, or P&I guide, is used, and I'll walk you through the different sections of the guide. So the P&I guide is a tool for making sure that there is a solid plan in place for the implementation of your grant program. The guide helps the project team understand the structure of the program, and the guide can be used as a training tool to orient new staff who join the program. The guide helps us as TA providers understand what is working well already and what the early challenges might be, and it helps the TA providers target our technical assistance. It also can generate ideas for connecting you with other grantees in your grant track, either in this fiscal year or previous fiscal years. As we hear of issues that the grantees are facing, we can connect you to other grantees for peer-to-peer learning, so you can hear from grantees who encountered similar challenges and how they overcame these challenges. And in addition, BJA uses the P&I guides to learn more about the programs and how the programs will be structured. There are 6 different sections, of the P&I guide, as you can see on this slide, along with an appendix with references. And there are specific exercises within each section. These exercises take the requirements that were outlined in the solicitation for this award and help you think through how to meet these requirements in practice. The appendix with supporting resources has a list of publications and webinars that assist in describing best practices in different areas, from risk, need, responsivity, to evidence-based practices, to performance measurement, and other topics. While you are going through the guide, if you have questions, you can use the supporting resources as well as your TA provider to answer the questions. So Section 1 of the guide asks for basic information about the grantee, the partners involved in the grant program, if there have been any significant changes since the application, information about who is on your task force or advisory committee, and how often they plan to meet. And it asks you to indicate which portal or portals of the RNR Simulation Tool you plan to use for your program. Note that there are exercises in the P&I guide for all 3 portals of the RNR Simulation Tool, but you will only be responsible for the exercises relating to the portals your jurisdiction selected to use during the grant period. Section 2 is about your target population. Who do you intend to serve, and how do you plan to identify this population? This is a really key section in order for all team and task force members to better understand who can be referred to the program. In TA, the target population is something that is discussed throughout the grant period as grantees strive to serve the number of people they proposed in the grant proposal. The exercise on screening and assessment asks about the specific tools you plan to use to identify criminogenic risk, mental illness, and substance use disorders, as well as how your screening and assessment processes will work. For grantees that choose to use the Assessment Individual portal of the RNR Simulation Tool, there's a table in the guide that matches questions on the portal with the information source. That is, the information you need to answer the question, and who will provide you with this information. Section 3 asks you to list the services and supports that participants will receive in your program and how participants will be engaged in services. This includes cognitive behavioral interventions to address criminogenic risk, evidence-based substance use and mental disorder treatment, and recovery support services. For grantees that choose to use the RNR program tool for adults, there's an exercise that asks you to attach the results of an output from the program tool and to answer a few questions about the quality assessment and which program features you would like to focus on for technical assistance. Section 4 is about collaborative comprehensive case plans and post-release supports. Per the solicitation, grantees are required to demonstrate ability to utilize a collaborative comprehensive model of case management, and to help grantees operationalize this, the National Reentry Resource Center, with support from BJA, launched a web tool on collaborative comprehensive case plans last month. And I think in your chat box, there's a link to the Collaborative Comprehensive Case Plans webpage. And so this web tool has a few different features, including case studies of 3 grantees that have implemented collaborative comprehensive case plans as part of their programs. And in each of these examples, a different agency took the lead in the case planning process. A community-based behavioral health treatment provider, a community supervision agency, and a sheriff's office that operated the local jail. There are also colorful graphics that display the interaction between the lead case planner and other entities and agencies involved in the reentry and recovery process. And when you're on the web page, when you click on each entity, you will see examples of information that should be included in case plans, so you can get an idea of the information that each entity needs to share with the lead case planner and vice versa. So for example, if a case manager from a community-based behavioral health treatment provider is the lead case planner and is working with community supervision as one of the entities, the case manager should share with the supervision officer information about the participant's criminogenic risk factors, the participant's history on community supervision, and any details that might affect supervision status or diversion programming, if applicable. The case manager should also share the participant's housing location and contact information and list of current medications. And then at the same time, the supervision officer needs to share with the case manager conditions of the participant's supervision and all of the criteria that is covered by the larger supervision plan. And then finally, there's a list of 10 priorities and components to keep in mind for case planning, with some brief descriptions of each, as well as links to resources for more information. In the P&I guide, there's an exercise that takes each of these 10 priorities and components for case planning and asks you to describe how you plan to operationalize the priorities and components as part of your processes. And for grantees that choose to use the Assess an Individual portal of the RNR Simulation Tool, there's an exercise that helps you think about how to use the results from that portal to aid in your case planning processes. There are also exercises that ask about the role of community supervision in the program and how participants will be supervised. The other categories addressed are about connecting participants to healthcare coverage and other benefits, and how post-release housing partners play a role in the program and what kind of services they provide. Section 5 asks about grantees' plans for data collection and program evaluation. This piece is a priority under the grant and for BJA. There are general questions about your plan for data collection and questions about defining specific measures such as successful completion and recidivism. And for program evaluation, there are questions about what kind of evaluation you plan to do and how you plan to use the results of program evaluation data. There is also a table that walks you through a logic model for your program. You can take your specific goals for your program and fill in the resources, activities, process measures, outcomes, and sustainability plans for each goal. For this section, it will be important to coordinate with your research and evaluation partner to fill this out and to think through how the logic model fits into the performance measures that will be collected over the course of the grant. Section 6 is about sustainability for your program. The questions ask about your goals that you would like to achieve after the end of the grant award and the activities and funding sources that are necessary to realize those goals. It is important to begin discussing sustainability at the very beginning of your grant program and to revisit it throughout the implementation phase. And for grantees that choose to use the Assess Jurisdiction Capacity tool, there will be some basic questions to get you started in the guide, but this piece of the tool will be completed later in the grant cycle. So that outlines the 6 sections of the P&I guide, and it is expected that grantees complete their P&I guides and submit them to BJA within 1 year of the award date. We recognize that grantees might have different timelines for when they would like to complete their P&I guides, And so we're happy to work with you to set up a goal for your program. After the P&I guides are turned into BJA and approved, grantees will move into the implementation phase, and we will still refer to the guides on a regular basis throughout our technical assistance calls to make sure that implementation is running according to plan. The P&I guides tend to be a great resource for grantees for onboarding new team members, to have a clear plan in place, and for technical assistance. So now I'm going to turn to talking about the RNR Simulation Tool and give you an overview of the different portals. So the tool is a web-based decision support tool that can help agencies identify what forms of programming will be most effective in achieving recidivism reduction goals and other priorities for their target population. The tool is also designed to assist with resource allocation and identify service gaps in programs within jurisdictions. The tool has 3 different portals: Assess an Individual, the RNR Program Tool for Adults, and Assess Jurisdiction Capacity, all of which are designed to work together to provide feedback and assistance at the individual program and systems levels. So the Assess an Individual portal builds on your criminogenic risk assessment as well as behavioral health assessments. It links to the program tool and enables users to build case plans based on the results. The program tool categorizes programs based on the behaviors that they target, and it rates key program features for fidelity to the risk, needs, responsivity principles, and evidence-based practices. The Jurisdiction Capacity tool takes a look at the system level and analyzes programming gaps in relation to population needs, and the results of this assessment can inform resource allocation and systems planning. So now I'm going to walk you through each of the 3 different portals. So the Assess the Individual portal has 22 questions to answer, and most of the information needed to fill out the tool comes from screening and assessment tools that you'll be doing as part of your grant programs. Based on the information you enter, the portal will show a program participant's likelihood of recidivism or the likelihood of success, depending on how you choose to view the results, and it will aid in providing program recommendations for the participant. And then what you see on this slide is part of the Assess the Individual portal output that recommends 3 best fit program groups. And you can see from this example output that there are 2 different groups listed, self-improvement and management, as well as social and interpersonal skill development. Another feature of the Assess the Individual portal is that it allows you to reassess individuals to gauge their progress and adjust services as necessary. The output will show you where the participant has made progress, the strengths of the participant, and where the participant may need additional support. Moving on to the RNR Program Tool for Adults, this portal has 2 main functions. The first is to categorize programs based on the behaviors they target, and the second is rating the quality of programs based on how well the programs adhere to evidence-based practices. The programs are distinguished based on multiple characteristics, including clinical hours, risk level, use of a manual, screening, and staff credentials. On this slide, you can see 6 different program groups into which the tool categorizes programs. So Group A is severe substance use disorders and may include programs such as residential substance use disorder treatment or intensive outpatient treatment. Group B is criminal thinking and may include cognitive-based criminal thinking curricula or intensive supervision with treatment to address criminal thinking. Group C is self-improvement and management and may include things like individual or group counseling or outpatient treatment. Group D is social and interpersonal skill development and could include anger management or group, individual, or family counseling. Group E is life skills development and could include employment services or education and vocational programs. And Group F is punishment or supervision only and refers to supervision or requirements serving only as sanctions or punishment for criminal activities such as fines or community service. And the Assess the Individual portal will make recommendations for programs in one of these 6 different program groups to help give you a sense of how the tools link together. The program tool for adults also provides a quality assessment. So in this feature, there are 46 questions to answer for this portal, And based on the information you input, the tool will give you an output that shows how well your program is adhering to evidence-based practices, including risk, need, responsivity, implementation, dosage, restrictiveness, and the tool will give you an overall score for the program. The percentages listed on the right-hand side show how the program is responding relative to evidence-based practices and not necessarily relative to peer programs. Higher scores indicate higher fidelity to evidence-based practices, such as need in this example, where the score is 87%. And then lower scores indicate less fidelity to evidence-based practices. For example, dosage in this output is 30%, and this domain would be a good focus for future technical assistance. The tool will provide specific recommendations for how to improve program quality on each domain if you click on each category. And then finally, the Assess Jurisdiction Capacity tool uses systems-level data to determine the distribution of existing programs and identify gaps in available programming. The portal makes specific recommendations for programming based on the risk and needs profile of the target population of the programs in your jurisdiction. The portal may support program sustainability because the outputs from the tool can help guide decision-making on resource allocation for programming directed at the target population. And in this example, you can see that the greatest areas of unmet need for programming are cognitive restructuring programs, mental health, co-occurring disorders, and substance use disorders. Based on these results, systems administrators and decision makers may decide to direct resources to expand these types of programming in their jurisdiction. And in the following months, we'll have some follow-up webinars on each of the different portals of the RNR Simulation Tool to do a deeper dive and explain more about the portals. And so now I'm going to turn things over to Lieutenant Dennis Pass from Rockdale County Sheriff's Office in Conyers, Georgia. He'll talk about his experience as fiscal year 2014 Second Chance Act Co-Occurring Disorders grantee, as well as his program's experience using the RNR Simulation Tool.
Hello, this is Lieutenant Pass, and I've put this into several different categories or several different items to consider. What things that we found that we needed to know. One of them was the benefit, the great benefit of our technical assistance. When we received the grant, we had a lot of questions. We worked hard on our proposal. We knew what we wanted to do, but we found that our technical advisor was really a specialist in this. They've done this before, assisted other counties, and I know for some things, developing the program, we knew a little bit of what we wanted to do, but they were able to show us that there was so much more that we could do with it. And one thing to remember is that they're not there to make sure that we're just doing the right thing, but they're more there to encourage us, to assist us, to really challenge us to keep on track, but they want our program to succeed. It's very helpful. You'll have your monthly technical assistance phone call, and the thing to remember is that it's not something to be really concerned about, because they recognize that you may not be the authority. That's why they're there. They're there to provide instruction in developing your program effectively. Now, one of the things that it talked about was the P&I guide. That really walks you through all the areas that are needed to be addressed to formally implement the program. Now, for us, we ended up with 123 pages, and that seemed like a lot. But that did include a resource guide on the end of it, but it helps you go through all those areas that need to be worked on to make sure that we're providing the services that we need to, so that when we start the program will start well. Now, having the right team and the right team leader is important, we found. For me, I was the team leader for the implementation guide, but we also have a behavioral health clinician, a case manager, an educational specialist, and a coordinator for the program who really looks at the day-to-day operations and makes things work as smoothly as possible. Now, for some things I found with the P&I guide was giving assignments to the person that knows the area that we're addressing very well, but not only giving them an assignment to work on some of the responses, but to review those responses as a team. Another thing, too, was making sure that we understand that we all put in a proposal, but when we go through this guide, they're going to show us things where there may be gaps in what our original plan was, and we've got to be willing to, we had to be willing to actually change some things, but it was also improve what we were doing. Now, the RNR Simulation Tool is very helpful. I'm not a clinician. I'm a lieutenant with the sheriff's office. I have a gun on my side, meaning I'm actually a law enforcement officer. I'm not a clinician. But that doesn't mean I don't care. I started in 1994 working with the programming at our facility, and I'm definitely committed to making sure things work. Our whole team is. So for the RNR Simulation Tool, it was great for me because I did not have to be a clinician to use it or understand the results. Now, there are going to be a lot of tools that we use. We use some of the TCU tools. We use the ORAS. We use CareLogic, the LSAR. Some of those may not be familiar to you, but the RNR Simulation Tool is an added tool, and in some ways, it takes some of the mystery out of assessments, because many assessment tools just give you what their risk is and their need, but this takes the risk, the need, and what may be available, what is available in your with your program that can address those needs. Another thing, too, is it helps with giving a good picture of their strengths and weaknesses. It also, with the assessments and reassessments, will give you will give you good progress on the participant. It identifies gaps. I like that, because when you do fill out the interventions you have under the different categories, you'll see that some may be not have as many things in it, and addressing those are definitely needed in order to provide comprehensive services. Now, some of the successes we've had is simply we've got less people in jail. This morning we had 376 inmates. We, in 2009, had well over 500. We actually surpassed 600. There are a lot of people that are not coming to jail right now because they've gotten some help. Now, what we have for programming is we have an RSAT program, which is 3 phases, 90-day in-facility phase, followed by another 90 days, and then a 1-year aftercare. And this provides, and this is what we have to consider, is what are we providing, but this provides some of those mental health services, the substance abuse addiction recovery services, the classes on anger management, trauma recovery, integrity training, parenting, a lot of things that really affect their success when they get released. The good thing is that when you've got them for 6 months in the facility and you're providing programming 7 days a week, they're going to get something from it. Now, one thing for a success, we had someone in our first RSAT program who went to court. He had only been 60 days in the program, and the judge said, I'm going to release you. And he told the judge, I can't be released now because I'm not ready. And so we asked the judge to let him stay and finish the program. Well, we've got to make sure that, we found that we had to make sure that the programs, the services we offered in the facility were something the participant was willing to buy into. They recognized what their need was, and they recognized that the services they were getting helped there. There are a lot of challenges. There's a lot of questions. Some of the challenges were, who should be at the table? Who should my stakeholders and partners be? What staff do I need for my day-to-day operations? What should my target population be? What are the eligibility requirements and rules? And as you work through the program guide, they'll help you answer those questions. Some of the things, too, are what forms do I need? That's where another facility has probably already created some of the material that may assist, that did assist us in providing services that were creating those forms that we needed. There are a number of other things in challenges. When an inmate applies to the program, do we accept them? You know, do we needed to make sure that they actually wanted help, that their purpose was to recover and not just get out of jail. So what we did is there has to be a clinical and administrative qualification for acceptance into the program. So those are some of the things that we had to design, and we did have assistance with that. Another thing, too, is choosing the right staff. We found that was a challenge. We had to find people that had a passion for this, that were properly trained and experienced. We had to make sure that they represented the right partners, and for us it was our mental health and substance abuse community provider and also a local health agency, United Way. And so getting the right people on board, the right agencies, and then actually selecting the right staff was quite a challenge, but it worked well when you took the time to investigate those people and choose the right person. We found that when you think about who leads the program, we've really got to be the authority. We aren't the authority now, but we have to do the work that is needed in order to become the authority on the subject. Really, in a lot of ways, too, to be a champion for the program, whether it's in the facility, whether it's in the community. And some of that being a champion is the courage to move forward when there are difficulties, someone that can make things happen. For us, sometimes unexpected things happen, and we've got to make sure that we found that we had to make sure that we were able to address those. One of which just happened last night. I had someone that called me, advised that they needed some help. They had graduated from the program, and they were evidently on a substance at that point. Advised them to go to the hospital, to the emergency department, and then we're working on getting them in somewhere. But the reason he was able to contact us is making sure that the participant has access to us after the release from the facility. And for most of the people that get released, at least in prior times, we're law enforcement. There's someone that has been in custody, and you've got to break down the barriers that are often present between, again, people in the facility and law enforcement. The success is just our recidivism rate. Our recidivism rate for our participants, we haven't been collecting, all of our participants haven't been released for a full 3 years, but they start out at about 58%, and they're now down to about 17%. That's about 200 people that have been in the program since they started, those with co-occurring disorder. If there are any questions, I'm glad to, in the next section, answer any that you might have or be of any assistance that I can.
Thank you so much for providing that great information on your experience as a grantee. We're actually going to open up to everyone on the webinar for questions and answers. So if you have any questions, you can feel free to either put it in the chat box on the lower right-hand corner of the screen, or we can actually open lines, and you can also you can also ask your question verbally as well if you're more comfortable with that. So thus far, we actually did receive 2 questions. One was regarding the Collaborative Comprehensive Case Planning Tool, and we actually put the link to that in the website, and the technical assistance providers will follow up with additional information on that too. Then another question that we had was, is there any updates on timelines for the grant budget approvals? And on that piece, I will hand it over to Andre to answer that.
Hi, everyone. So as a policy representative from the Bureau of Justice Assistance, BJA, there are no updates on timelines as it relates to your budget. You should send an email to your state policy advisor, also known as the Programs Office Unit. Thank you.
Excellent. Thank you, Andre. So the next question is there a planned grantee conference? And I think I can try to answer that question. So as of right now, there is not a planned grantee conference. In your budgets, you'll notice that you were required to budget for that. And as planning continues for any potential in-person events, your technical assistance provider and Bureau of Justice Assistance will coordinate on that and be in touch with you. If we have any information, you will be the first to know about that. The next question is, who should be on the technical assistance calls? So that is an excellent question. Mark, do you want to provide an answer to that?
Sure, yeah, so we usually recommend that on the monthly technical assistance calls that there's at least one representative from each agency that's involved in the grant program. So what that usually looks like for Second Chance Act co-occurring is we'll have someone from the correctional facility, someone from the community-based behavioral health treatment provider, someone from community supervision, if applicable, and then folks from other social service or support agencies as necessary.
And I think especially for the orientation calls, when everyone in your jurisdiction is trying to wrap their heads around these complex programs, it's good to try to get stakeholders together for that call so everyone understands a little bit more about the grant and the training and technical assistance that's offered, so that way they are aware that you do get resources with the grant, which I think usually jurisdictions are pretty excited about. So a question for Lieutenant Pass, is there any, if you had to name one thing that you wish you had known before you started the process for your grant, what would that be?
I think if I wanted to know something, I would have said some of the interaction with other agencies as far as the budget. I probably would have wanted to know some of the specifics on how, this sounds a little bit confusing, but I found it quite a bit of a challenge because the budget is from our finance office, and yet I'm the person here at the with the program. So
I think that makes a lot of sense. Yeah. So it's like the complex nature of who's managing the budget in a jurisdiction versus who's implementing a program, and how do you manage that relationship? Also, potentially subcontractors to other vendors as well.
Correct. Yes.
Okay, another question is if we could provide contact information for the programs office via phone number or emails for the grant. So we're happy to do that. We'll have the TA providers follow up with you. So different people in different regions actually have different contacts. So different people on this webinar will have different contacts. So Mark and Allison will follow up with you and make sure that each grantee actually has the email and the phone number for each of the state policy advisors that they should be contacting. So we're happy to follow up with you on that piece. Then another question is, where can I find out more information about the RNR Simulation Tool? So that's a great question, and we are going to add a link to the RNR Simulation Tool in the chat box. And as we mentioned before, your TA providers can answer some questions on this, and we do plan to work with George Mason University, Center for Advancing Correctional Excellence, who created the tool, to have a follow-up webinar to go into greater detail, so that way you'll be able to select the pieces of the tool that you would like to use. So there will be more information that'll come for you before you have to make that selection. Okay, if you have any more questions, please feel free to ask them in the question and answer box, or you can verbally ask them if you unmute your phone line as well. So we'll give it about another 30 seconds, and if we don't have any more questions, then we're happy to finish early. So I want to thank everyone so much for attending this webinar. As I stated earlier, the National Reentry Resource Center is incredibly excited to work with each of you as grantees. We look forward to having the orientation technical assistance calls and working with the Bureau of Justice Assistance to make sure your programs are all a success. If you have any questions, please feel free to follow up with us. You probably have Mark or Allison's emails, and my email is available as well. So thank you so much for joining the webinar, and we look forward to working with you over the time of your grant. Have a great afternoon.
Thank you.
Thank you.